And UNC also lends a hand to us in recruiting physicians. I mean, we've added a lot of physicians to our community, like in surgery and others, and they help us recruit. And Dr. Isley, I want people to know when a new physician is recruited this area, they are asked to stay in this, or they're required to live in the community, aren't they?
So yes, so UNC does help. I work with Carol Batchelor, who is assigned to Nash as an employee of UNC. She lives here in the community with us, does a tremendous job in recruiting. I will give some benefit to UNC, they do help us, but Carol really has championed this. The board has been very explicit with me that they wanted physicians to live in the community. Mm-hmm. We've set up our recruiting so that those physicians are encouraged. As you've been with us, and Dr. Perlmutter, you know that the first physician we recruited, it was a little bit of a challenge to get them to live mm-hmm. here, but we've recruited over 20 physicians over the last 2 years, and over 90% of them live in this community now because we are able to put them with individuals, their peers, who are raising their families here in the community, and they actually help us recruit more physicians in. And so it's easier and easier every time we recruit a physician.
Right. They have to go to our churches. They have to go to our grocery stores. They have to really invest into our community because
raise their families here.
Right. Have to do their banking here because when those things exist, the likelihood that that physician will stay are enhanced. Having an itinerant physician drive up from Raleigh to provide care and then drive back home is not the ideal situation.
And we're getting, I know there's several of my son's classmates growing up here who are back here, Dr. Pazak and Dr. Martin. And we are recruiting more. I mean, a lot of younger doctors here. Dr. Nelson, Dr. Clay Nelson's son has come back. So it's happening, folks.
So we are beginning to recruit some of our own native sons and daughters back, and so that's
who would otherwise go.
That's
to
right, and it certainly is rewarding to be able to do that. And I think, you know, there are certainly some extenuating circumstances where the physician's not able to live within the community. And what I'm really emphasizing to the physicians that we recruit is that we want you to be a leader in the health system. We want you to help develop it and bring your voice to the table, and that's a challenge if you're not in the community.